Did you know that giraffes and humans have the same number of cervical vertebrae? And while giraffes never complain, humans often struggle from neck pain. Well, I've never seen a giraffe holding a phone. Today we're going to talk about the cervical spine, why you might be in pain, and if you are, how to relieve that pain. Let's discover this together. Hi, and welcome to another episode of Physio Talks with Tom, the channel where we simplify your problems and give you effective and clear solutions. Now, before we dive deeper, let's clear up a common myth. Many people are unsure about physiotherapy. Some people are afraid of it, and they think that it's just about treating a pain after an injury, or even worse, that it's just a massage. But here's the truth. Physiotherapy is much more than that. It helps you move better, recover faster, and prevent things before they even start. It's not something to be afraid of. It's a tool which gives you back control for your own body and health. So in this video, we'll keep things simple with covering 3 key points. A quick look at the cervical spine, why neck pain is so common, and simple practical strategies you can use to start feeling better. Now let's talk about the anatomy of the cervical spine. The cervical spine is consisted of 7 cervical vertebrae, C1 to C7. Each is placed one on top of the other. In between, like the lumbar spine, in case you missed it, will be the video around here. The intervertebral disc, as I said, is placed between of each cervical vertebrae. Also, it's important to know that the cervical spine supports the head, which is like a bowling ball. It weighs around 5 kilos, which is like it's a bowling ball. It's enough to know that it consists of 7 cervical vertebrae, ligaments, and muscles. For now, if you like, of course, to analyze this topic more, write it down in the comments if you like to see more about it. As you might guess it, the most popular reason why you might be in pain is sitting on your phone for a long time scrolling. As I like to label this, will be the texting syndrome. It's important to know that is the most important reason why people nowadays are in pain. The next reason is the starting positions. As I said before, it's not healthy to stay in one place for more than 25 minutes. Keep moving, changing positions. The next reason why you might be in pain is sleeping on the couch in a very, very bad posture, like this, or texting in this position. Very important to avoid it, and very important to be informed that this posture is the most common, let's say, reason why people are coming to me saying that I'm in pain and what I have to do about it. The use of a cell phone in a very bad posture. Instead of using the phone in this position, try to avoid it and keep it in this position at the height of your eyes. Avoid sitting too long. I've said it before. Start moving and not sitting for too long, especially for more than 25 minutes, and it's important to keep it there forever. Sometimes can be from bad posture while sleeping. If you sleep in a very bad position, chances are that muscles can be tightened and the blood flow reduces. Another reason, the use of more than one pillows, very common. For example, you want to watch TV and you use 2, sometimes 3 pillows. Your neck and back is elevated. So if you fall asleep in this position, chances are that your muscles will be tightened in the morning. So what are the practical solutions? As a first thing, you have to fix your posture, like the lumbar spine. So if, for example, you fix that position, for example, chest out, as already mentioned, the chin goes in. So when you are in this position, you keep a proper posture for your neck to prevent the lack of this curve, which is very important to avoid future problems if it happens to you. Take a break after a long time of sitting or in staying in one position which triggers the pain on your cervical spine. For example, you start moving your shoulders, your neck, or even better, you stand up, you walk, okay? And if you are in a seated position, looking down all the time, for example, you sit on your phone, you start doing some opposite exercise. Which is the opposite of flexion? It's extension. It's simple as that. If you want to dive deeper, let's go to do some stretching for the neck. Starting stabilizing your whole one side, for example the right one, with your arm, with your hand beneath the chair. After stabilizing your body, bend after, using the other arm, try to stretch your neck, pulling your neck to the opposite side with a tilt of rotation of your head. It's important to know that stretching is more personal, let's say, because you have to feel the stretch until some point. If it's too painful, try to avoid that state and go until you feel the stretch with a slightly tension. Finally, if the pain is persistent and is limiting your daily life, physiotherapy is going to help you treating that pain and prevent future problems happening again on that area. So your cervical spine is strong and flexible, but modern habits tend to overload it. The good news, with small, consistent habits and changes, you can bring your cervical spine in a very healthier and more controlled status. So if you find this video useful, make sure that you hit that like button, subscribe, and share it with someone who is in pain or he might be not. Just to inform him, because the truth is anything new we learn today could be useful tomorrow. And remember, keep moving so you keep living. See you in the next one.